A study published in the Journal of the American Dietetic Association found that toddlers aged 12 months and older consumed a third of their daily calories from snacking between meals, with the snacks becoming less nutritious as the children got older. Dietary patterns low in fruits and veggies and high in sweets and saturated fats began to develop between the ages of 12 months and 24 months, and this pattern tended to be established by 24 months. That's a fact. But there's hope. Parents can establish the foundation for a healthy diet early in life when eating habits and preferences are being formed. Simple dietary changes, such as offering more nutritious snacks, can help prevent obesity and chronic disease in our children. So switch the gummy bear for blueberries and see them growing healthier and happier.
Good morning. Welcome to Defining Your Health Talk Show. I'm your host, Dinah Morales. This morning we have a very special guest who is going to be sharing her experience of being pregnant during the COVID-19 pandemic. Our guest is Miss Justine Ake. Miss Young was born on May 15, 1990 and is one of 9 children to Wilhelmina Rosita Young. She lived in Ladyville Village for the most of her life and now lives in Orange Walk District, Tower Hill Village, with her growing family of 4. She's the wife to brother Adrian Ake and a mother of 2 sweet, adorable boys, Adonijah and Azrael Ake. Miss Ake completed her bachelor's degree in business management at the University of Belize in the year 2015. And started her career immediately after as a secretary to Pastor Louis Jesse, executive secretary at the Belize Union of SCA for the past 5 years. She now serves as the secretary and cashier of the Central Belize Mission. When she's not momming, wifing, or working, she enjoys the simple things of completing crossword puzzle in lesser minutes than others and spending time with her loved one as best as she can. Justine's hope is for her name to be called to be part of that heavenly kingdom together with her family and friends. Good morning, Miss Ake. How are you doing today?
Hi, good morning. I'm doing okay, thankfully.
Okay. Pregnancy is a special time full of excitement and anticipation. But for expectant mothers facing the outbreak of the coronavirus, it's not the same. Fear, anxiety, and uncertainty are clouding their otherwise happy moment. Can you tell us of the first thoughts that came to your mind when you heard that COVID-19 was in Belize, knowing you were pregnant? What were some of the emotions that you began to feel at that time?
Well, for me, when I found out about the pandemic, I wasn't that worried for myself, really. But I think my family and my husband, they were the ones that were carrying the worrying and the stressing and everything for me. They were making sure that I always have my mask, always carrying my sanitizer. But I think for me, I tried to keep it, I minimize the stress as possible because I always remember Pastor Juliet always tell me from my first pregnancy that whatever you put in, you bring out. The baby comes out with it. So I try to control my mental state as best as possible. So I was trying not to let the pandemic get to my state. to my well-being. I just tried to make sure that I was together this time. So I wasn't really worried until the ending of my pregnancy, the last trimester. I think when we got the news of the lady that died, that had the C-section, and she went from the hospital the 2 weeks and she passed away. I think my breaking point, and
Right.
I really got worried, and from there I just started to stress. But then I remembered what Pastor always tell me again: input, output. So that was where I tried to control as best as possible. So yeah.
Very good. Did you and your husband have a plan set in place for how best to protect both yourself and the baby during this time?
After the pregnancy or throughout the pregnancy?
It, both. You can share both, but I initially meant before the delivery of the baby. Like, was
Oh,
there a plan how you're going to be going to work and all of that stuff?
okay. Well, yes, we had a plan, making sure that we have our mask as much as possible, trying to minimize going to public places as best as possible. If we needed to go anywhere, we just try to keep our 6 feet distance, sanitize as possible. If we go grocery shopping, make sure we clean as much as possible everything that we got before we went in. My husband, he was the one that was going out mostly during the lockdown. So he would come in and making sure that his shoes is outside, his clothes is in the laundry as soon as possible, making sure he has no contact with us until he's bathed. So all those things, yeah, we made sure that we were safe as possible.
Okay. How challenging was it for you, being that you're a working mom, and I know you live in Orange Walk and you work in Belize City and you have to commute daily? I'm not sure if you commuted in the public transportation or in your private vehicle, but even if you did in your private vehicle, when you reach work, you had to be around your colleagues and different person in the office. How challenging was it for you to with the social distancing, wearing your mask, it's something that we're now getting used to because we have to do it to protect ourselves. But when you're pregnant and you've had your a pregnancy before this one, you know how sometimes it can get hot. You feel like you can't breathe. So, I mean, what was it like for you having to commute daily? You had to protect yourself because you were constantly being around people. What was it like for you? Did you forget to keep it on sometimes? How did you maneuver yourself during this time?
Well, fortunately, everything happened right in time, I would say. Because when the mission started, the treasurer, Mr. Ismail Gomez, started as well. So he lives in Corozal and he was traveling as well. So that way we were able to commute with him to carpool. And that made it so much easier for me, um, not having to get the bus. So that was really perfect. But there were days when he wasn't coming to work. So because he has certain problems with his, personal, and we had to get the bus. So that was brain
Oh,
crazy already. So whenever we get that news that we have to get the bus, I would just say, you know what? I'm not going to let this take control of me. My husband was the one really worried. So I would just get in the bus and just focus on reaching my destination, keep my mask on. If I, and make sure that I'm not eating my breakfast because, when you're
yeah.
pregnant, the cravings and everything start kicks in whatever time you have no control. So when I'm on the bus, I try to control my hunger, keep my mask on because they said if you're eating, you don't have to use your mask, right? So I was normally using that as an excuse at the beginning to just eat and not use so that I don't have to use my mask. But then when it got more crazy, the cases started to rise and I had to get the bus that time. I was like, you know what? No, I'm not eating anything. I'm keeping my mask on, making sure that I reach my destination as fast as possible and sanitize as much as possible, keep my hand from my face. So all that was, taking control of my surroundings. When it comes to reaching to work, we weren't all that, keeping that mask on from the beginning. we were mostly using our mask basically for myself for not, getting charged. That's what I was using mask for at the beginning. But we reached that point where we had to keep our mask on because of our health. So it came to that point. Everybody had a sanitizer in their office. We even reached the point of getting a Clorox wipes, wiping everywhere. If anybody comes in, we wipe off everywhere and we keep that distance from each other. And unfortunately, also working with treasurers, we got a new software where we don't have to have that interaction with the treasurers on a daily basis or a weekly basis. They were able to send their reports through that software and make deposit through the bank. So all that came in perfect timing where we don't have to have much contact with people. So it came in a right time at the same time where we could control whatever, situations.
Okay, so all the timing was so important for you that you didn't have to always be fearful. And I keep hearing you say something which I would like to put a pin on. You said you always try to just focus on not being worried about all of these things, but just focus on having a healthy baby. You mentioned that your superior told you to input output, and that it looks like it's something that you use. So whenever you would get that feeling of becoming fearful, you remember that input output, and that somewhat was a coping mechanism for you. Let's talk a little bit about prenatal checkup. As a part of the safety protocol set in place, they ask you that you stay home as much as you can and social distance when you're outside. Can you share your experience of going to the clinic or hospital to continue with your prenatal checkup? Were you afraid of being in an environment where sick people were? Because at the clinic and the hospital, people go in for various ailments and you don't know what they're going in for. How did you navigate your way through these appointments?
Well, I don't know if it's the second child effect, but when you have your first child, you make sure that you do all your monthly checkups as best as possible. You do
Right.
all the right things that you're supposed to do. But then you get your second child, and like everything just starts to slow down. You start to get slack. But I don't think I use it as an excuse. I think, but I think my main reason was to not visit the doctor as best as possible. I think that was keeping me away from my doctor as much. I think I only visited the doctor throughout my pregnancy, probably about 4 times. And you have to go through a 9 months pregnancy. So
Right.
it's every month, and then the last month it becomes every week. So that shows that I really wasn't going there if I didn't have to. I made sure that I took my prenatals daily. I made sure I did all the right things by eating the right things, drinking the right things, and doing what I need to do. Because I noticed that when I went to the doctor the first time, I didn't know who to trust. We didn't know what to do. Like, you keep your distance. They had the seats where you one stay here, the other is over there. But fortunately, I should have started with that. I wasn't attending clinics. That's a good thing. We made sure that we were going to a doctor where we could actually make our appointments to our convenience. With appointments, if it's 10 o'clock, it's 10 o'clock. Most times, at least. Sometimes the doctors they take at least 15 minutes. Some days, and if it's 10 o'clock, you get in, you see your doctor, you do your checkup, whatever it is that you need to do, and you're out right there and then. You don't have to wait long hours to see the doctor to get checkup and all those things. So that's an advantage that we had throughout this time, seeing him and get out. So I wasn't all that fearful, but at the same time, I was by not going to the doctor as often as I should have. But thankfully, everything was perfect, I would say.
Okay. What were some of the prenatal care that
Hello?
was advised or given to you by your doctor for you to practice at home? Because I remember reading in an article, and it's not just for Belize, around the world, some of the fears that expectant mothers have during this time is that, how do I keep myself healthy? during the pregnancy, you have all different stages. I remember at the first 3 months, I had really bad morning sickness where I could not keep anything down. Now, during this time, it's advised for us to keep our immune system as healthy as possible. Were there any tips given to you by your medical doctor to assist you in keeping this prenatal care, as best as possible?
Well, not fully, I would say, because I wasn't really giving him much concerns. But he was always telling me to make sure that I take my prenatals, do my keep my nutritions, the diet as best as possible up going, not doing much takeouts as possible, do your homemade meals as best as possible. Um, your immune system, if that is up, then the baby would be perfect, at least as healthy as possible. So for that, yeah, I think it's just the not eating outside as best as possible. Because my first pregnancy, he was telling me, you can eat whatever you want. You are pregnant. This is the only time you can eat what you want. But with pregnancy, he was like, nope, you have to cut down that as possible, as best as possible, because you don't know what can happen out there, and then you get sick. And then when we heard that the pregnant women, they are the ones that mostly, would be affected by this corona badly, that we won't be able to control it. So we're trying to make, you know,
Okay. Would you say that your first pregnancy, would you say that it differ from this one? We know that the situation surrounding this second pregnancy was a bit different in terms of, not being able to go out, not being able to enjoy, some family time. There's, as best as possible, you had to stay home. You had, as you mentioned, not eating out. And I know you're a very active person. So that might have, during this time, it's already so stressful. You have so many fears, so many anxiety, and then you're not being able to do some of the fun stuff that you would have liked to do. How would you say your first pregnancy differed from this one?
well, with the first one, we had family gatherings all the time. My family is huge, like my biographer mentioned, from 9, and we had birthdays probably every month. And that's a reason for us to get together. Even if we're not celebrating birthdays, we're together no matter what, right? And so we always hug each other. We're always there, grinning, laughing, all up in each other's face. Not worrying about anything. But now with this pregnancy, it was completely different. You had to keep your distance, keep your mask on, sanitizing, less contact as possible, less gatherings as possible at the beginning. And now at the ending, with this pregnancy, it is completely lonely. It was lonely, lonely, lonely. You had to keep your circle really, really small. Even though they're your family, you had to keep it small. It's either your husband, whoever is in the house. Those are the only people that can get to see your baby, and that is lonely. The first pregnancy, when I at the hospital, we were able to have as much people as possible in the room, receiving that joy, that love, and that gathering with the baby. And with this one here, the only person that was able to come in the room was my husband, the nurses, the doctors. Those were the only ones, no visitors. And that was really, really sad, bringing a baby into this world. You want to share the baby as much as possible to them. And not being able to do that, that was really sad. And even up to now, my family still haven't really seen the baby, hold the baby. They have just seen him on pictures, and if they come by, it's like they're over that side in Corozal and I'm in PG. Feel that way, in the same room, but not being able to be close to each other. So it was really sad and lonely, but at the same time, trying to just keep your mental state for the baby's sake and my sake. So, yeah.
Okay, we're gonna go in a
It was
break
sad.
shortly, but before
So those
we
are
go
my
into our
2
break,
pregnancies. The
can
first
for a
one was
mother that
pure
is
joy.
looking
The
at
second one
this
is pure joy as
video
well.
right now, this presentation right now, what would you share with them? Some of the stuff that you did to keep yourself? You mentioned that you were lonely a lot, especially coming from a big family. What were some of the things that you would do throughout the day when you're not working that will help you to keep your mind off stuff, to get you busy, to help you to feel as normal as you can possibly feel?
Myself,
Yes.
what I would do, I didn't get the beginning of the question.
Yes, sorry. I was asking you for a mother who's home watching this
Oh,
presentation and is pregnant, is probably fearful. What are some tips that you use for yourself to keep yourself distracted, to continue to be as normal as possible? What can you share with them that they can probably try? Maybe they're at home, they're feeling lonely, and they don't know what are some things that they can do. Can you just give a few examples of what you did that helped you during this time?
well, we have to use advantage of our internet usage, right? And I'm sure everybody have internet at home. Play some nice music. If you're not playing music, listen to some no, you can watch some series. There's Netflix, some good one. There's some family movies for them to watch. And if you're not into those things, you can read some books, do some puzzles. I mean, I love puzzles. Puzzles never gets old. Whatever is your hobby, you do it. You can go outside, get some fresh air. I mean, outside is amazing, especially at sunsets. All these things that we can do that we wanted to do when we couldn't do it, and now we have the time to do them. I think this is a perfect opportunity for them to do that. Take a walk, take a nature walk in your yard at least as best as possible. Um, Eat. This is a time where we're given privilege to eat as much as we want to eat. People always say when they're lonely and sad they eat ice cream. I don't see that. I don't think that works for me. But if that works for you, you eat what you want to eat. You talk to people on the phone, call them on video chat, text people. There's always someone there available, willing to listen to you. So, use their internet as much. You have it there, you just take advantage. You don't have to see them face to face as much, but we can't do that. So just call them, talk to people, listen to people. So many people with problems, and you have the time to listen to them. So all those things, you just stay focused, and rather than just being sad, that doesn't help. You want to remember, you want to bring a new baby, a healthy baby into this world. So your mental state is important. And in order for you to control that, you need to control your surroundings and taking advantage of God's nature, God's whatever God gave you, you use it. Learn a new recipe. That's a good one. That's what I did in the lockdown. I tried so many new recipes. Some of them not bad, not good, but learn every day. You have the time, so use it. There's Google. If you don't have a recipe book, just Google whatever it is that you need. So just take advantage of the time that you have and sing to the baby, pray for the baby, read for the baby, and you will notice that the time will go by so fast, and one day you'll see your baby is in your hand. So just stay focused.
I like that, Miss Ake, and I can tell from the way you're expressing yourself that this is exactly what you did to keep yourself focused. You mentioned that the mental state is very important, and yes, we must emphasize on that. You won't, whatever you're feeling is being transmitted to your baby. Remember, the baby is inside you, so you need to ensure that your mental state, that you are feeling well, so that the baby can receive all the nutrients that it needs to have from you. We'll take a break now. We invite you to stay tuned. We'll be right back.
Abigail.
Yes, Gran?
Abigail, I can't breathe well.
Granny, we need to go to the hospital to get you checked out.
No! I'm fine.
Yes, Gran, we need to go now to get you treated. Now, before it's too late.
No.
Grandma, we need to go for all of us.
No.
Stop. If you are having flu-like symptoms, please call us immediately for medical guidance.
If you have chronic conditions such as diabetes and you're experiencing symptoms such as shortness of breath or chest pain, please also seek medical attention immediately. We lost a lot of people this year. We don't want to lose you too. Please seek help if necessary. Call us at 0800-664-2273. Continue to wear your mask at all times. Keep physical distance when in public and stay at home unless absolutely necessary. This message has been brought to you by the Ministry of Health and Wellness.
According to the Center for Disease Control, men die on average 5 years earlier than women. While women are expected to live an average of 81 years at birth, men are expected to live an average of 76 years. With non-Hispanic blacks having the lowest life expectancy at nearly 71 years compared to white and Hispanic males. That's a fact, but there's hope. One of the factors contributing to worse health in men is the higher prevalence of cigarette smoking among males than among females at any age. By quitting the habit, males can reduce their chances of dying from any cause and experience a longer and happier life. So don't delay, quit today.
These are indeed troubling and uncertain times. The COVID-19 pandemic rages while the death toll surges. Many lives have been lost to violence in the streets. Homes have been terrorized with domestic abuse. Natural disasters in the form of storms and fires have devastated our land, a constant reminder of the times in which we live. Jesus is soon to come. Here in the Belize Central Mission, our mandate remains the message to all the world. In the midst of all these tragedies, we have not relented from our mission of preaching, evangelism, and ministering to our youth and community. The Central Belize Mission has been blessed to reach great milestones to this end, including the launch of our very own Adventist television network, which now serves as one of the mediums in carrying the gospel to all the world. ATN has allowed us to continue this work by streaming various spirit-filled programs via its Facebook and YouTube account, as well as on cable TV. This has allowed many individuals to have come into a saving relationship with Jesus Christ through the virtual evangelistic campaigns and revivals. As we contemplate these breakthroughs, we want to encourage everyone, whether you are a regular member, visiting online viewer, or a community member, to double up with God in your Christian stewardship. God has been faithful to us, and His mercies are renewed each day. We may have fallen short in our faithfulness in the giving of our time, talent, or finances, but now is an opportune time for us to double up with God. Let's double up with Him by returning what is right in tithes and in our love gift offerings. Contact your local church pastor or church treasurer to find out how you can give. If you have been blessed by the ministry at ATN and would like to partner with us, you can join the ATN family by giving your charitable gifts. Giving to ATN can be done in multiple ways. On your tithes envelope, there is a designated line for ATN. You can place your donations along with your tithes and offering. Sign up to become a monthly or a one-time sponsor using the ATN donor pledge form that is provided in a pinned post on our Facebook page. After you sign up, we will contact you to make arrangements of how you can make your donations. You can mail your checks to House B, Upper Flat, 374 Mayflower Crescent, Lake Garden, Ladyville Village, Belize District, or drop by our studio on weekdays, Mondays to Thursdays, between 9 to 5 p.m. at our ATN office or Central Belize Mission office. You can also make direct transfers marked for ATN via online banking or in-person deposits to the following bank account number: For our international donors, you can make your donations via the PayPal app or by sending donation to BZ Adventist TV by means of the following link, using your PayPal account or your credit and debit card. Thank you for your generosity, and we pray God's richest, most abundant, and continuous blessings on you and on the Belize Adventist Television Network as we seek to engage in meaningful, relevant, and life-changing ministry in today's world. Welcome back to the Finding Your Health Talk show. This morning we have in our midst Miss Justine Ake, who was pregnant during the COVID-19 pandemic, and she's here sharing her story with us of what it has been like. So far, she's shared her first thoughts and emotions that she began to feel when she learned that the COVID-19 was in Belize. She also shared what are some of the steps that she had to take in protecting herself and her newborn during this time. She also mentions what were some of the fears that she had and how she was able to cope with this fear in order to be in a good mental state for herself and her baby. Mrs. Ake, let's talk in our first segment, in the first part of our interview, we talk about prenatal care. Now let's talk about the delivery process. What were some of the questions and fear that you had for your doctor regarding giving birth? What exactly, how would I put it? What exactly were some of the concerns that you had going to the hospital to deliver your baby?
Well, my main question was, will there be room or the opportunity for others to go in, Like the first one, we had as much as possible anybody that can go in. But I know this second one, I had to ask if more than one would be able to go in. And sadly to say, that was a shutdown. The only person that can go in is either your husband or whoever you choose. So automatically that became my husband. So that was it. It was just my husband, nobody else. And that was the saddest thing to ever receive. Other than that, if I had to wear a mask in the surgery, and that was the saddest one as well. I had to keep the mask on as long as possible. Other than that, but the fear of going to the hospital at the same time was if how clean is the area,
Right.
I mean, it's at medical, but nowhere nowhere is safe. Corona respects nowhere, no one. So
Right.
even though it's at a private hospital, it's still, you still worry. You still have that thought in your mind if if your baby will be safe, if you will be safe, if your husband will be safe, if the doctors and nurses, if they're doing what they should be doing to be safe as well, so that we don't get infected. All those things, I had in my mind, and but at the same time, trying not to, worry about it too much. But other than that, it was safe that I came out corona free. My baby came out corona free so far. So yeah, the
Okay.
fear and the question, all those things, it was safe.
Okay. If you don't mind me asking, did you have a C-section or was it a natural delivery?
A C-section again, and that was where my fear came in because, like I mentioned earlier, the the young lady that passed away, I think she lived in San Hill. Um, she had a C-section, and it doesn't matter where she had her C-section. Corona respects no one, nowhere, like I mentioned, right? So when I heard that news, I think that's where I really got worried. I said, I have to get a C-section again. So am I safe?
Right.
Will this happen to me? My families, when they received the news about the young lady, they start sending messages, and it just started to get out of control. One moment, it just started to get out of control. I was at work when I received the news. I started to freak out, like, am I safe? Will I be safe throughout this C-section surgery? Will I be able to come out corona free? Will my baby be able to come out corona free? All these things I had to, try to go through my mind. I even reached to the point of going to Pastor Gillet and Mr. Gomez, asking them if I can work from home for my last week, because it was that time. I think it was my second to the last week when I received the news. Unfortunately, they told me that I would be able to work from home for my last week. So I was very privileged to that I had to control my environment as possible, staying at home, communicating with people through the phone. I had no contact with people. The only people I had contact with was the one that was in the household. And I'm in Ladyville, was at Ladyville in that time, and I'm still in Ladyville now. So all these things I have to, had the control of controlling my environment. And we're safe so far, hoping to keep safe continuously.
Right. What role did your doctor play throughout this entire process? Because you said when you got the news that the lady had passed away, and the situation surrounding her delivery in terms of the C-section, you began getting scared. Did you talk to your medical practitioner? What did he have to say? What role did he play in giving you some type of comfort for you to be able to be at ease going into delivery?
Well, really, beginning, like, let me see. I went to my doctor, I think the week before. I was supposed to go to him that same week, Thursday of my last week. And I think that's the reason why they mentioned that they had a new protocol of no one visiting your room, trying to keep us safe. And they're not doing us any bad, they're not doing us any wrong. They were trying to keep us safe as best as possible. So, in order to keep the room clean as possible, making sure that the doctors and nurses, they're doing their part in sanitizing. Everybody came in the room with their mask on. All these things they ensure we will be safe the entire stay. I had to stay for 2 nights and 3 days. So all these things, they were making sure that they were protecting us and not doing us any harm. So he was there just trying to make sure that I was okay. And it's just a whole funny story with my whole surgery situation, my whole delivery situation, because we had all this plan, to have the surgery on the 9th of September. And it just all happened that I called my doctor this Saturday, August 29th, with a pain, and I didn't know I was going through labor any at all. It was from a Friday night. I thought it was, I was going through a diarrhea situation, but it was not that. It turned out that I was actually going through labor. And my visit to the doctor was 3 o'clock, I think, 3:30. All these things, it was just going mind blowing. But I'll wait for those questions, so you can continue.
Okay, and as you're mentioning that, yes, indeed, I remember receiving a call, a text message in one of our SDA chat groups saying that, please pray for Miss Justine Ake that everything may go well with her delivery. And I was like, but it's really super early for her to go in, because I know you had always mentioned about September. But let's share a little bit of your experience regarding the delivery process. How did it differ from your first pregnancy? I guess this is the moment you're waiting for. You can probably give us some of the details of the difference between the two?
Okay, sure. The first one, that firstborn child, you're always prepared. You have your bags prepared probably 3 months before. You have everything prepared. But with this second pregnancy, my second labor, everything was just crazy. Like you mentioned, I have always said that my baby was supposed to come September 9th, and that was the surgery date, September 9th. Everybody knew September 9th. That was like a song, September 9th. And it just happened August 28th. Late at night, I was going through pain, but my first pregnancy, I had no pain. I had no labor pain, nothing whatsoever. I just went in the surgery, getting back, had my C-section, had the baby, no experience of whatever, of any natural feelness, nothing at all. I had no experience. So with this second one, when I had those feelings, I wasn't even thinking about a baby coming whatsoever. I just thought it was just a phase. And I just slept, kept on sleeping with the pain. I had no idea what it was. So until the morning, I told my mom, that was August 29th. I told my mom what was happening, and she was like, Justine, are you sure you're not going through labor? And I was like, I don't know. You all have to tell me if that's labor. I don't know what it feels like. It was like my first child I was going through. And it was until the evening of that same day where my mom said, Justine, I think you need to call your doctor because I think it's labor that you're going through. I was like, no, I don't think so. I was trying to, push it back because my baby shower was the next day,
Oh, wow.
the third that's my baby shower. I said the baby can't come yet. I didn't have my baby shower. So I was like, no, 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 it can't be that. And I was scared that if I called my doctor, that would probably be his same answer that it's labor as well. So I called him 3 o'clock, and when I called him, he said, you know what, Justine, this is labor. It's happening. I was like, no, 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 that can't be that it just can't. No. So he asked me how often I'm feeling the pain, and it was like 10 minutes to 15 minutes every often I was feeling that pain, the same pain. It's like the baby just got so tight. So he told me, you know what, you need to come as fast as possible. And at time he thought I was in Orange Walk. So he said, how can I get to Belize City the fastest way possible? And he was so happy to hear that I was in Naderville. So he said to come as fast as possible. And the craziest part of it all, I didn't have my baby bag packed whatsoever. I had nothing. Most of the stuff was in Orange Walk, not even washed, not even ready or prepared, nothing at all. I had a few stuff here in Ladyville that we got throughout the week for the baby. And when everybody heard that, the doctor said it's labor I'm going through, they were like, no, no, no. Everybody just started to get crazy. My mom started to get the stuff that they had, started to wash them. I mean, all those things, it was just crazy. I just started to stay calm. I went to the doctor. I reached there, I think it was about 3:45, I think. He told me, Justine, when he checked me, he said, no, this is definitely happening today. And he told me to have to be 4 o'clock. And I was like, no, it can't be 4 o'clock. My husband even he wasn't even here at the time. I had called him immediately after I called the doctor. He was in Orange Walk. So he had to leave as soon as possible, bringing everything down that we had for the baby. And when he was able to reach in time, but he wasn't allowed to go in the surgery room like he did the first time. He was allowed to go in there, but the second time, no. They told him he can't go in. Remember, we had no bag, no baby bags, nothing at all, nada. I wasn't even going there hoping that, it was happening, actually giving birth. I was expecting to go back home and, enjoy my baby shower the next day, but that wasn't happening. Told me this is definitely happening today. So the baby came at 4:34, no clothes, absolutely no clothes. They had to keep him in a blanket as long as possible until they brought the clothes. My husband, he gave me all the story afterwards that they were behind constantly, where is the baby clothes? Where is the baby clothes? He have no pampers, no nothing at all at the hospital. And it was just so crazy. Like
You
going
see,
through labor and at the same time preparing for a C-section, that is nothing to play with. Like I asked God, I wanted to feel something, God, at least something. But I regretted that prayer. I regretted it. It was crazy. So yeah, that is my labor story. It was just, I think everything reached at probably half an hour to an hour after the baby was born. And we went up to the night, they were still bringing stuff because the nurses told my husband that the baby was 4.8 pounds. That's the amount of pounds he had when he was born with. They call it this mature. And so my sisters, they brought up premature pampers. And the nurse was like, no, this can't fit your baby. Your baby is not that small. And so we had to call again. Well, my husband had to call again to let them bring pampers to the right size. All these things, it was just so crazy.
and I'm here sitting and I'm just laughing because I'm saying, God works in mysterious ways. Some people may have very sad C-section stories, but you have a very fun and interesting one that you can go on to share for years to come, eventually with Azrael when he gets bigger, knowing all the things that had to happen. And what I must bring out from this story is that thank God for a big family, because if you kept saying that, your sister brought this, your mom brought this, your husband. So God always works in mysterious way. And I'm happy that you were able to share that story with us, because I remember when I had my daughter, I don't know if it's because it was my first pregnancy that I was so, I was anticipating this moment so much that I had my bag packed like from a month or a month and a half before. And I remember every time I felt any little pain, I was like, okay, today is the day. And I would take my bag and always coming back with my bag, right? So after that, I remember I had to go in to get induced and all of that. So, my story was a little bit different. But as I'm here sitting, I'm like, wow, she really had. And what I like about this experience that you're sharing is that you always have a smile on your face. You always see things not in a negative way, but in the positive way, like you were saying. I didn't think it was labor. I just had a little pain going to the bathroom. I mean, some people during COVID-19, you're expecting you have to go to the hospital. Just the fact that you're having pain and then, oh, maybe today's the day, I need to go to a hospital. You start panicking, I need to get this, I need to get that. And as the mother, you start freaking out. Everything coming down on you. But you didn't do that. You were still denying it. You were in denial. Nope, it's not coming today. And the other people from your family was there supporting you. So it's very important to have a strong support system during this time. It's also important that I've been getting from your story is that you need to be, jovial. You need to accept things as they are. Try not to overthink everything. Yes, you're pregnant. It's COVID-19. It's a pandemic. You can be infected, but as long as I do my best to try and protect myself and my baby, I just have to learn that it's a part of life. And, I would have to live as normal as possible. Now, let's talk about postnatal care. What has it been like for you caring for your newborn? I know you mentioned that family cannot come around. I am guessing that, you don't go out with the baby. What are some of the things that you've been doing at home to nurture him and to keep him at his best?
Well, so far, my family, they play a big role in this whole situation. Understanding at the same time. My husband made mention, even my mom, that we can't have any visitors over as much as possible. We had to cut that down. Um, Keeping the baby, even if someone comes in the house, me and the baby would be staying in the room. If anybody comes, we keep a mask on. I keep my mask on. I have to keep sanitizing my hands whenever I go to my baby and make sure that, washing my hands as possible, washing my face. If anybody comes in, they have to take a shower before and then get rid of the clothes that they had on and replacing that with new ones. Even my husband, because he's going to school at this moment, every day have to attend report to work. So he himself have to come home, take a bath, change his clothes before he even touch me or touch the baby, or even touch my little babe, my boy Adonijah as well. So he himself, he is a kisser, he's a hugger. I mean, he wants to go outside to play and at the same time come in the room with the baby. And as he sees the baby, hug, hug, kiss, kiss, hold, hold. He wants to do all these things, but at the same time being dirty. So we got him into this, into this routine of washing his hand and sanitizing. So whenever he sees a baby, he tries his best to, keep his hands clean, but forgetting it at the same time. He's 2 years old, so he doesn't remember that all the time. So he would say, you know what? He would just jump on the bed, go to the baby, and want to kiss the baby. And I was like, no, baby, you have to keep your hands clean. You have to keep your face clean so you don't get the baby sick, right? And so all these things, he was trying to be understanding, but at the same time, it was super hard for him, So, back then, before pandemic started, we always had this thing when you have a new baby, you had this big bottle of hand sanitizer that everybody had to use before they come and see the baby. No kissing, no nothing. And look at it now. We have a pandemic and it is way more serious. You have to instill the hand sanitizer. You have to instill the mask, and the mask represents no kissing. So all these things is just so crazy now that we're actually doing it. Back then, people didn't want to do it, even though you had your sanitizer there. It just went there and the sanitizer stayed full. And now you have to replace the sanitizers often, right? It just shows how crazy it is that this pandemic changes everything.
Yeah, first people would say, oh, we have to do so many things to just go and see a baby, but now it's understood that it's a procedure that they must follow. You mentioned of your little boy Adonijah, who is 2 years old. What it's like to be the mom of two boys? Because I know what they always have this saying, terrible twos. How have you been able to manage giving your care and attention to your newborn and also being a mom and taking care of your son? Or is it a shared responsibility that you have with your husband?
Well, it is a shared responsibility. At the beginning, it was, but now he's an urban dwarf, so he had to go home, deal with the house. So right now, I think it was from Sunday up to now. I have this crash course in, so that's 3 days, 4 days now. I think it's 4 days, Sunday to Thursday, and 5 days. And I have to deal with the baby. I have to deal with the boy, with my baby boy. And my mom helps me, so that eases the pain. She cooks, she prepares the meals, she cleans the house, she washes the baby clothes, Adonijah's clothes, my clothes. So all these things that was taken off my back. I don't have to worry about that. It's just to take care of the baby as much as I can. And with Adonijah, even though we have help here, he still wants his mom. If he doesn't see his mom in 5 minutes, I think right now he's probably outside wondering where I am. It was so challenging to get him out of the room to stay outside because he would be a distraction. And he was like, no, no, he wants to come in. So I had to close the door and then I heard him crying. But he went outside. Thankfully, my niece was here, so she's keeping him distracted. Even before this meeting, I had to give him a bath and I had to give the baby a bath. And that was like 9:35 when Chantel called me. I was changing them at the time and I was just going crazy. So all those things, I have help. I'm grateful. I'm really, really grateful because if I didn't, my hair wouldn't even look like this. It would probably look like this. Crazy right now. I probably wouldn't even do the meeting. I would probably back out because I would probably be so stressed. But I'm grateful that I have my mom and I have my sister here. My husband, even though he's not here now, he's still here with us. So all these things, yeah, I'm grateful.
Yes, and as you're mentioning there, indeed, as mothers, we always have to multitask. We always have so many things that we have to do, and especially when you're a working mom. Let's talk a little bit here about C-section care after the surgery. I know I've had a C-section, and I know it can be very, very challenging when you're recovering the days after your surgery. the pain that you have, especially dealing with a newborn. I remember sometimes at night when we were supposed to have feeding, sometimes I would be so tired to get up that my mom, thank God for mothers, and especially for those who are always there for us, as you mentioned, my mom would wake me up, it's time to feed, you need to do this, you need to do that. Sometime in the morning when she would tell me, did you remember when I woke you up this time to feed the baby? I don't remember those stuff because I was so tired. And I remember also when I was at the hospital, my dad used to take me for walks. You know, with the C-section, it's important that you get back active, have that blood circulation going there. You mentioned that you're currently staying in Ladyville and your husband is at your home in Orange Walk. You have a strong support system, I must say that, and you're very grateful for that, as you mentioned. But personally, let's talk personally here. How have you been able to cope with giving care to both of your son and also self-care? What has it been like for you?
Well, truthfully, I had one of the worst postpartum depression from the first week. The first week was crazy. My first C-section, the only thing I had to focus on was getting healed, externally at least. Getting healed outside, that it takes probably a week to 2 weeks. But internally, that's like months. I don't think you ever get healed from that. But with this C-section, it turned out that I had some side effects where I had a migraine for at least 4 days. I came out of the hospital with a terrible migraine, a stiff neck, a back pain, all these things. It turned out that it was the side effects of the anesthesia. And I wasn't aware of it because they said that it was leaking and I didn't know it was that. And every single day from that moment I came off the Monday, the migraine was just there constantly, 24/7. I had no idea how to cope. I couldn't even look at a screen. I couldn't even open my eyes to lights. The lights had to stay off. I stayed in a room probably for all those days. The entire day I was sleeping. You know that thing that they said, sleep when the baby sleeps? The first pregnancy with my baby, I didn't do that. I couldn't do that. The second one, I literally took advantage of that. I had to take advantage of that. Whenever the baby is sleeping, I am sleeping, completely sleeping, because I thought that normally if you sleep, the migraine goes away. I took pills, nothing worked. I drink teas. I was drinking water constantly because the doctor keeps asking me, how is it going? You have to stay hydrated. But all these things was not taking the migraine away whatsoever. And it just took me into a crazy, crazy moment where I was just, what? I can't. Everything was just frustrating me. And I think that wasn't helping the migraine whatsoever. It was just there beating, beating, beating. And I thought that every day would be a better day, but it wasn't getting any better until I think probably Thursday or Friday. That was when I had better days. And I was super grateful that I got up on one morning. I didn't have the migraine whatsoever. I was like, thank you, Jesus. Thank you, Lord. The back pain was gone. The stiff neck was gone. It was super difficult throughout those days to even breastfeed because I found out that whenever I sit up, like completely sit straight, that's where and when the mind starts to kick in and when the back pain started to kick in. And then my poor baby, he wants to be fed, but I can't feed him, so he had to be bottle fed for most of the time so that I can be healed. Because if I wasn't able to heal myself mentally with my migraine and all these things, then I won't be able to take care of him or even my baby, my Adonijah. So all these things I had to make sure that I took advantage of my surroundings and I said, you know what? We need to get rid of this migraine. And I keep constantly praying and asking God to take it away because it's not helping. It's not helping my babies, my mom, and anyone. They were just coming there constantly asking me, are you okay? My husband was becoming like a pain, asking me, are you drinking your water? Are you drinking your water? He keeps on asking me. He brought, I think, a bottle of water like 10 times for the day that I was drinking. And I said, I'm keeping hydrating. I don't know why I still have this migraine. But I think it was just a lesson where I had to keep connected with God, as much as possible, keep to myself, take advantage of the quiet. I was just becoming crazy, staying in a room, being contained in a four walls room, had nowhere to go. The bathroom was right in the room. So that was no reason for me to go outside and take a walk. I couldn't even do that. I had to walk in the room because, walking heals the cut. So all these things I had to do in one room. And thankfully, I'm grateful today. I can safely say I am better. I am doing super great. I mean, I still have to take my time moving around because of the cut, but other than that, I am super grateful. I have no migraines, and I can be here talking to you, sharing my testimony.
Amen. We want to thank you, Mrs. Ake, for taking out the time out of your busy mom schedule to be with us. We appreciate the experiences that you have shared with us. And one thing I want to draw from this story to our viewers is that take life as it comes. Don't try to overthink everything. Try to see the positive things in life. Try to depend on God. Trying to find things that is going to keep you busy and is going to help you to heal. We want to thank you once more, Mrs. Ake. We hope and we pray that you continue to have a good recovery from your surgery and that all will go well for you and your family. To our viewers at home, thank you once again for joining us. We invite you to join in next time for another edition of Finding Your Health.